Let's try this again. We got to prepare for this guy coming up. Good afternoon. Here we go. A little Army spirit. I'm going to say Air Force is behind that too. Anyway, I have the auspicious honor to introduce a colleague, a friend, someone who we just were talking about. I know, I knew back in 2006. And I was a dean at Edmonds Community College, and that's where I met Jeremy Grisham, was at Edmonds Community College, and when he was just beginning his journey of transition home. Coming back, and Veteran Conservation Corps, Vet Corps, help with Vet Corps, the Veteran Conservation Corps, but I'm distracting from his bio here. I could cry. Dr. Jeremy Grisham is a licensed mental health counselor, educator, ecotherapist, and medically retired U.S. Navy hospital corpsman. With over 2 decades of experience spanning clinical mental health, trauma recovery, veteran services, higher education, and public policy. Dr. Grisham, I really love saying that. I mean, because I met him when he just was beginning his journey, right? Before. Dr. Grisham is a recognized leader in trauma-informed care, ecological healing. His scholarship and practice are rooted in liberation psychology, critical pedagogy, and reciprocal ecotherapies, approaches that center both individual and collective healing. Dr. Grisham has served in key leadership roles at the Washington State Department of Veterans Affairs and Antioch University. His work focuses on supporting those impacted by moral injury, complex trauma, and structural, systemic, and/or generational violence, especially veterans and marginalized communities. As a speaker, program developer, and clinician, he champions a systems level approach to self-care, sustainably, and justice in behavioral health. And I'm just going to tell one quick story about Jeremy. He and I have presented over the years together to varying groups. And Jeremy led Veteran Conservation Corps with volunteers coming out and restoring communities, restoring basically environments. And Jeremy was sharing a story with me about his healing one day, about how he was out in the woods struggling to rip off the ivy and all this bramble from a cedar tree, and how that experience for him was healing because of the experience you had. You remember that story?
I remember it. Is it okay if I share it really quick?
Share it, please.
So
I'm going to sit down and let him do it.
So we worked on.
Come on, get that speaker.
Thank you. We worked on habitat restoration, and in habitat restoration, a lot of it is we have to work in those areas hard because of urbanization, urban sprawl, and that sort of thing, human development. And when we disturb the soil, it just makes it rich for the introduction of invasive species. And in this spot, we were clearing out a bunch of knotweed. And is anyone familiar with knotweed? I think there's some conservation folks in here at STWS. And it grows, it's like this really tall shoots, 12, 14 feet or something like that. They have beautiful broad leaves and everything, but it's remarkably resilient invasive plants. And it can little tiny, little millimeter of shred, if you're cutting it and little pieces go into the ground, that little tiny bit can grow into all new shoots. And it grows through concrete and it just outcompetes everything. And it's remarkable because it's a really long process of removing those species so that you can introduce native species and then restore ecosystems. So I was clearing out the knotweed, effectively just pushing it down so that we can, as a part of the treatment plan. And then I came across this young cedar sapling, probably, hey Watsy, can you stand up really quick? And please forgive me, I have my 2 sons with me today. We actually drove out to Wenatchee thinking the conference was there, and then hauled over here. And Watsy, come on over here, man, real quick. And so the sapling was actually about Watsy's height. And so if you can imagine a young tree standing in the middle of all this knotweed, but it wasn't just a knotweed that was, blocking the sun from it. It was covered in English ivy and morning glory. So it had these two different vine species on it and everything. Sorry. And, okay, Watson, thank you so much.
Take the mic out.
And then, okay. Sorry. Sorry, everyone. And so then I just started, I got something triggered in me in that moment because I just got really angry. And it felt like that tree was suffocating. So I tore everything down, and it was the most remarkable feeling I've ever felt, because in that moment, it was like the heavens parted, and this ray of sun came down right onto the cedar sapling. And it was, for me, that's when I knew that this was the path, because the invasive species were the symptoms that I was experiencing. The invasive species were the systems that I was dealing with. They were everything that I was struggling with, and to be able to help that sapling, have a chance, felt good. And that's what ended up with the career with the Veterans Conservation Corps and that sort of thing. And please forgive me for interrupting, Peter. Is this a good transition?
That's your baby.
Thank you so much.
Yeah, thank you.
My name is Jeremy Grisham. I usually start, when I do something like this, I usually start with a kind of an interactive story, if that's okay with everyone. And if you sat in these, how many have sat through me ramble through conferences? And a couple folks, okay, a few. You might already be bored of the story, but it was a story that was shared with me from a member of the Duwamish tribe. And if you know anything about the Duwamish River in Seattle, it's the only river remaining of five native river systems. And the Duwamish is the only one left. And the Duwamish is pressured with industrialization. It's like coming through Auburn and Kent and Tukwila, and then coming out by the port of Seattle and everything. And there's a lot of work that needs to get done over there. So anyway, I'm rambling. I'll stop. Member of the Duwamish tribe, and the story goes like this. I call it, what do I call it? Raising the Sky. I think that's what I call it, but I don't think it has a name. Anyway, the story starts off with an old man with a hunchback, and he's walking one day, doing his thing. He's got his hunchback, and his kid comes up to him, and the kid says, "Old man, why are you walking like that? Why don't you straighten your back?" And the man says, "I can't, because the sky's too low." And the kid's like, "Well, just raise the sky. Like, what's the big deal?" And the old man said, "I've tried that already. Thank you for suggesting it, but it's too heavy. I can't do this." And so the kid was like, "All right, well, I'm young and strong. I can do what I want. So I'll push the sky up for you. Problem solved." Okay, old man. So the kid gets themselves ready. I try not to gender the story, except for the old man. Anyway, so the kid prepares themselves, and they count to three. 1, 2, 3, and they push, and they push, and they push. And what happens to the sky when the kid's pushing against the sky? Nothing. Absolutely nothing. It doesn't do anything. The old man chuckles and says, "Thanks, kid. I appreciate that. Now, if you don't mind, I'll have a nice day. I'll just continue my business." And then the kid's like, well, hold on. I used to live in Everett, so I usually practice this story right in Everett. And the kid's like, well, what if we get everyone from Everett? Can you imagine? Who knows of Everett? Who's been there? I love that town. It's a great place, but it's got, anyway, challenges. But this kid was able to communicate with every single person in Everett. And they got everyone together at the same time. 1, 2, 3. And this is where the interactive part comes in. And I'm going to need your help in pressing up against the sky, if that's okay with everyone. 1, 2, 3, and they pushed, and they pushed, and they pushed. And then what happened to the sky? It moved, but like this much. And I was like, oh, well, that's impressive. All right, well, so thanks, but yeah, I'm stuck. Thanks, but all right, thank you. The kid's like, wow, so if I can press it up an inch with all of Everett, what if I get Linwood and Bothell and Lake Stevens and Marysville and maybe even, I don't know, Mount Lake Terrace involved? And so they did. Got all those communities together, and at the same time, maybe they had like walkie-talkies or something like that, but at the same time, 1, 2, 3, and they pushed, and they pushed, and they pushed, and this time, how far did the sky move? Like like this much, just enough so the old man can start to straighten his back. But what happens when you've been sitting in one position for too long and then you finally start, like, I'm old, so it doesn't take that long to do this, but if I'm like sitting cross-legged for like 5 minutes and I get up, it hurts. It really hurts. And that's kind of where the old man was, because he's like putting his back in a space that was uncomfortable, it was new, he hadn't done this since maybe he was like, I don't know, young. And he's like, yeah, I appreciate that, but that's uncomfortable. I don't like that change. I need to go back to the way it was because I'm more comfortable with that. Kid's like, okay, old man, but what if this time we get everyone from Bellingham down to Olympia, maybe even get all the folks over in the peninsula involved, and then, I don't know, let's get Cle Elum in there too. And that's exactly what the kid did. Got every one of those communities to contribute to raising the sky. But this time the kid's like, well, we've been moving it with our hands, but what if we get these really big sticks and then push up at the same time? And that's exactly what they did. Now this time, with all these really big sticks, on the count of 3, ready, 1, 2, 3, and they pushed and they pushed and they pushed. And that's how the sky got as tall as it is today. That's how the mountains grow as tall as they do. That's how we've been able to build buildings as tall as we can. That's how birds fly as high as they can. And that's how the man was able to straighten his back. And that's the story. And I like introducing that story for a particular reason. And what would that reason be from your perspective?
Community makes change.
I'm old and deaf. Well, community, yes, that's exactly right. And it is, and that's why it's so important to be in these spaces, because we're building community here. We're raising the sky. We're moving mountains. And hopefully we're reaching out to people who need services the most. And so I tell the story in part to acknowledge how important community is, how important diverse communities are, and I lost my train of thought. How important communities are, but really to thank everyone for being here, to being a part of these conversations, because they do matter most. And I'm here to talk about moral injury, really understanding it and incorporating some dialogue about what self-care is like. And from anyone's perspective, what is moral injury? Any thoughts? Yes, ma'am. Right here. No? Okay. You can tell me and I'll repeat it.
Experiencing something that goes against what you believe in, what your soul speaks.
Hi. Yes. And she said that it's an event that takes place that goes against our soul, our belief structures. And that's exactly right. Moral injury is exactly that. Is moral injury a diagnosis from the American Psychological Association found in the Diagnostic and Statistical Manual 5TR? Can we find it in there?
No.
Yeah. So why are we talking about moral injury? We'll get to that. What is self-care? We all know what self-care is, right? Because we're all rigid practitioners of taking care of ourselves. What's that? What's that? No?
Cheesecake.
She said it's putting on deodorant, and heck yeah. I mean, I need like layers of that stuff, especially on days like today. That is part of self-care. And as we have the conversation, yes, ma'am?
Ways of building a life that you want.
Ways of building a life and practices that, yes, exactly.
Greater.
It's also self-care it's a combined effort of really kind of like walking ourselves through the rigors of life. And that's what we're talking about today. Can I have the next slide, please? Okay, so we already started identifying moral injury. We're also going to discuss the consequences of moral injury and begin to develop language for helping ourselves and others. And then let's talk about practicing self-care. And so there'll be some interactive dialogue in this, because it's not my job to define what self-care looks like in the individual's life. It's our job to talk about it for ourselves and to really understand it and to be able to put it into practice. Next slide, please. All right, so here's the question. Is moral injury endemic to one group or community? I'm asking this question for a very specific reason. Why is that? I mean, kind of in line with why we're here today, right? Because a lot of times when we're talking moral injury, we're talking about veterans and veterans communities. But moral injury is a human dilemma, right? And so by that nature, it does affect everybody. Next slide, please. All right, so what is moral injury? It is, and please forgive me for reading verbatim, effectively distress caused when events take place that impact our moral code or moral bearing through, and that's exactly what you said earlier, through acts of omission, acts of commission, and by witnessing events that are just awful, right? That's like, we had no control to stop it, we had no part in it, but it hurts all the same. What are acts of omission? I think I have it. Listen, it's okay to read it. What was that? Okay. Acts of omission are effectively those acts that we choose not to do that might cause harm to other people. Acts of commission are acts that we make a choice. I'm going to take away your birthday. And that's a choice, acts of commission. And then witnessing acts beyond our control that are in conflict with our moral code, which have caused harm in some way. Next slide, please. I did that on purpose when I set up the slide deck. Okay, acts of omission and commission are choices. Choosing not to act in a given circumstance and choosing to act in any given circumstance. In context of moral injury, these choices have impactful consequences that are felt in direct and complex ways. We'll watch a short video, it's like 3 minutes long, kind of talking about an example of moral injury in a family dynamic. And but before we do that, what would be some examples of moral injury? Has anyone dealt with this before? Seth?
Thanks. Let me turn it off.
Good job, Peter. So my dad, Vietnam vet, on mission. Their commanding officer had to be relieved, and a junior officer took over. So this junior officer was super ambitious. His first chance to lead a crew into a mission, and whatever that mission was, it resulted in my dad witnessing children being murdered, and he was very against it, and he was very vocal about that. And so when they got back to base, he had made the decision that he's going to go and report that this illegal activity had happened. And on his way to go make that, several members of that unit intercepted him and told him, if you go into that tent to make a report, you're not going to live tomorrow. And so he didn't report it. So again, witnessing an act that he had no control over, but he also had the act of omission. So
He effectively didn't take a stand, and that sat with him for a long time. Thank you very much.
If you're talking about a veteran, it'd be a combat veteran who, you go out and you're trained to kill. And that's what you go out to kill, nothing else. And to me, I was in combat, I was a go-getter in Vietnam. And I had a real hard time the first couple of weeks I went out. But after that, it was just like a job. You'd go out, you shoot. Maybe you kill, maybe you didn't. And that's what really, I think, hurt.
It's an interesting dynamic when we're raised to, not hurt people, and then we're in these circumstances in combat. I was served in combat also in Iraq, and then there's a conflict there. By nature of killing, in that sense, even if it's justified through war, it's a conflict. But if I'm hearing you correctly, also firing our weapons without seeing the target, where are those bullets going, for our sake? And then who do they hit? And what are the consequences? And there's this massive element of unknown damage that can be caused. It does sit with us. And thank you so much for sharing. I appreciate that. In the back, yes.
They want to hear it.
I work with as a peer specialist at the VA, and we have a lot of really young veterans that had all these experiences when they were deployed, and moral injury really prevents them from moving forward in their recovery. Our chaplain runs a really great group for that, but it's something that just stops progress. You have to forgive yourself.
Thank you very much for that. And also, thank you for your work as a peer counselor, peer specialist. That's where it's at, because you're meeting people where they are, and from my perspective, that's one of the most important jobs in the state, in the country, because you're out there meeting people where they are, helping them by relating to them and being human in human spaces. Thank you so much for what you do. Thank you. Peer counseling is massive. It's massive benefit, and it's something that I've benefited from in my life, so thank you very much. Yes. Oh, yes.
And it's in a little bit of a different venue because it's not with death and destruction or anything, but you're in a command that gives you an illegal order, like when they started the recruiting program with the civilians and bonuses and like a unit's like, it's okay, you use your active duty time to do all of this, and you have to become an independent contractor, you've got to do all of this. And not doing anything about that for your command. You know, it's impacted 1,500 people now that are all putting people in the military that they haven't been trained to, and then when they don't come back, what are those people?
That's a wonderful, thank you very much.
It doesn't have to be, it can be.
Yes. Yes, and we'll find out. It can be a broad spectrum of circumstances that impact us in a number of ways. I've spoken to an Air Force member who loaded bombs onto planes, and that act was an act that hurt, because where do those bombs go? Especially when the planes come back with empty payloads. It's like, yeah, what happens? Broad spectrum of circumstances. In this YouTube video, we'll learn of one that's not combat related, and I'll give a really quick example of my own personal experience, non-combat related. My daughter has a terminal illness. It's called idiopathic multicentric castleman's disease, and I'm very proud to report that she's lived past her 5-year, 30% mortality rate goal, and I'm so deeply proud of her. She is my hero because she is currently about a year away from graduating with her master's in clinical mental health. But she was going through the business. She actually was airlifted from Seattle Children's to Cincinnati Children's, and so that meant I had to get my ass up and go travel to Cincinnati. And one of the times I went to visit her, they gave me permission to take her out of the hospital. I was like, fuck yeah, this is gonna be awesome. She's my language, everyone. And it was really cool because we're gonna go get chicken and waffles. And in Cincinnati, they have some chicken and waffles. And so we're super excited. I got her loaded up in a wheelchair, and I'm carting her through downtown Cincinnati. And we eat this really great chicken and waffles. And then we start heading back to the hospital. And I'm a hospital corpsman. Patient safety is primary goal number 1, right? And so we're walking back from the restaurant, going down this hill on this rickety old Cincinnati sidewalk, and what is that? The
Handle?
wheelchair. The wheelchair hit a little bump, uneven patch on the sidewalk, and then she's been in the hospital for months. She has no muscle strength, and she just went flat down and hit the pavement with her face. And of course, it was just devastating. It's like, and I just kept repeating. I just kept seeing her fall like that again and again and again because I knew better. Act of omission. So I wasn't thinking about it. I was excited and all that stuff, so I can justify all that stuff and everything else like that, but it still hurts, right? And those are the events that non-diagnosable, but they have impact and they stick with us. Tony, is it okay if you play? Thank you so much.
To me, it begins with being human, because this moral
It's just a guy sitting at a desk. It's okay with just audio. That's okay with everyone.
Thing, this is at the very center of human life. Some of my colleagues in theology have published this amazing volume called Moral Injury in Sacred Texts. And there's one chapter for each sacred text of the world, you know, the Bible, Quran, all of them, and showing how moral injury and its consequences and its causes are like, these are the stories that we've been telling ourselves forever, because this is what life is about. So empathic, just experiencing a person, you know, as another person, and say, oh my God, if I had just lived through what you lived through. Yeah, here's an example, and this breaks my heart to even think about it. But I was consulted by a psychologist a year or two ago to consult with a family they were working with, a couple who had their infant daughter attacked by the family dog. And the dog chomped down on the baby's head, and brain damage, and still not clear how severe the disability will be for the baby. So this happened at home with dad in the next room fixing a meal or something, and the first thing he heard was this scream and growl, and he went out there and pulled the dog's jaws off of his child. So I am consulted, and I sit and speak with this couple, and guess what? Their individual responses to this traumatic experience were very different, because he was home. He failed. She didn't fail. He failed. And it doesn't matter that there may be nothing he could have done to prevent that from happening. He will always, until his death, will feel responsible for that, because that's how we're wired. Social institutions are not capable of moral emotion. That's why we have to feel them for our institutions, because corporations don't feel shame or guilt. They don't feel anger. So we have to feel that for them. So to me, that's like helping this person begins with setting aside whatever kind of, theoretical understanding you might have of that. And just as a human, that had happened to me. Oh my God. It's like nothing else matters until you can sit with that, right? That's crazy. But the clinicians were actually criticizing him for not doing his homework and not seeming to recover and improve as fast as his wife was, and that's adding insult to injury, literally, and we do it all the time. It's heartbreaking.
I wish you could have seen that gentleman. His title is like director of I don't know, behavioral health services for the Marine Corps, something like that. But he's touching on some really important points. He's giving an example of moral injury, right? But then he's bringing up this sort of thing of this is human. Moral injury, to have moral injury is to be human, right? And so then, is moral injury a bad thing? Is to be hurt in the face of human suffering, is that a bad thing? No, that's a human response, right? And, but why is it a problem? Why are we talking about it? It's a problem because he was touching base on this, the idea that those clinicians were giving him crap for not doing his homework, like his cognitive behavioral therapy exercises and all this other stuff, when he's wrestling with the fact that he failed his daughter. Anything could have happened in that moment. And so he's got to find a way, he's got to find the language to speak to it in his own way so that he can help himself move forward. The clinical homework is bogus. I'm a clinician, and I'm happy to say that because if we're just handing people these resources without listening to their stories or without really understanding what's going on, treating moral injury as if it's, bipolar disease or something like that, then what are we doing? We're adding insult to injury. And so then I always kind of come back to this sort of, and please forgive me everyone, this ethical dilemma with moral injury, because I don't know how many times I've walked past someone who is housing insecure, who has food insecurities. When I walk past and just deliberately ignored human suffering. Do we beat ourselves up for that? I mean, we kind of do, but then we kind of don't, right? Because we're just letting it happen. So then it's like, okay, so if moral injury exists as part of the human experience, then what do we do with that? And how can we use that to make change within ourselves and then with others? And sorry for that side note, personal vendetta on moral injury, but I think it's important to pay attention to because these are human issues we're really talking about. Next slide, please. So what does living with moral injury look like? Well, I'll just read it. It looks like guilt, shame, anger, sadness, self-hate. It could show up in behavioral changes that could lead to social isolation or withdrawal. How come? Why do people isolate when they're dealing with heavy emotions? Yes?
Probably because the reality of what they saw, what they had to do, what they had to experience is just too awful, and they compartmentalize it.
They compartmentalize it because it's too awful. Thank you very much. Yes, sir?
I can announce, fight or flight.
Fight or flight. So there's a kind of like a neurophysiological response in that with our nervous system. And so we're either shutting down or we're reacting in some way, shape, or form. Thank you very much. Another, yes, sir?
It's more, I would think of it as an idea of self-punishment as well.
Okay.
You've done something wrong, so now we all have that sense of punishing ourselves, removing ourselves from the social element.
That's an absolutely wonderful observation, in part because what do we say to ourselves in those moments? We say, they'd be better off without me, right? Which leads to other outcomes. We isolate because we don't have language to speak to how awful it is, what we're thinking and feeling, or how badly we feel about ourselves. Yes?
You got it.
I was just going to piggyback off that. Also, self-preservation. It's a preservation tactic, especially when we're feeling extreme shame or guilt or anger, and we don't feel safe out within a community of other people.
That's a great observation also, in part because we already feel poorly enough about ourselves. We don't need everyone else looking down on us for this stuff either, and so we protect ourselves from isolating. Is that accurate? Thank you. Yes?
Thank you, Jeremy. Fear of being judged, fear of being, looked upon differently from the people we love.
Yep, that's absolutely right. Yes, thank you. Yes?
I mean, I was basically going to say the same thing. It's like we're judging ourselves and we assume, like, even though we might, like, they don't know what we did, part of us is like, they're obviously judging us because I'm judging me. And so we put that on other people as much as we put it on ourselves.
Thank you very much. And I'm going to, okay, one more, yep.
The energy that it takes to compartmentalize and to cope with the fear and the guilt and the shame and everything else kind of sucks up all the energy to where we can't be present with others.
My energy drains pretty quick sometimes. Yes. And yes, we do have energy. And all of that, all the emotional stress and which triggers the neurophysiological stress has impact, right? And it does drain us and exhaust us. Moral injury also makes us question our faith. Moral injury may overlap with existing diagnoses such as post-traumatic stress disorder, trauma-based stress, depressive disorders, or anxiety-based disorders. A lot of kind of overlapping behavioral patterns with all this business, right? Next slide, please. Okay, so I didn't introduce myself fully at the beginning for a reason, in part to tell a story of my own relationship with moral injury. I was a hospital corpsman. Normally, I have like a stupid dad joke. I don't have to ask this question here, but normally I ask, does everyone know what a hospital corpsman is? And most people say no. And I usually say, well, it's like an army medic, but better. Sorry, everyone, sorry. I love the Army, they're great. So I served as a hospital corpsman out of high school as a high school dad. So I have my daughter, my oldest daughter, she's 32 now, has her own first day of kindergarten, was yesterday. I just moved. But anyway, had her in high school, joined the military, joined the Navy, became a hospital corpsman, and I became an emergency medical technician at 18. I worked in advanced cardiac life support. At 18, I was like Johnny on the spot. I thought I was awesome, And I had this inherent motivation to take care of the people that I was called to serve. And when I went to Iraq, I realized through the course, as the months dragged on, that I was grossly unprepared I was arrogant, egotistical, and because of my ego, I caused harm, point blank, and I sat with that when I came home, I was first overwhelmed by all the senses of the United States. It's crazy, because, and sorry for the ableist language, but being in Iraq, it's like, how many people have been in the Middle East? Spend time up there. What's the color palette? Brown, dirty whites, like gray, orange, like that sort of thing. And then come back to the States for the first time, and it's like cool, fresh air. It felt actually really chilly at 75, and there's billboard signs everywhere with colors and lights, and you go to the commissary and people are loading up shopping carts, just so much. But on top of that, I was still sitting with how much pain I had caused. And please don't get me wrong, I'm deeply proud of my service. I served the 2nd Battalion, 5th Marines, and they're the finest battalion in the United States Marine Corps. And they're biased, of course, but I believe it's true. And so honorable service, but combat, as you both were talking about, people get hurt, right? And I did hurt someone who reminds me of my children. And she sits with me. She's here with me right now. Because of those events in Iraq, it changed my moral compass drastically. It changed how I saw myself, how I saw the world, and it introduced this path of service, in part, to try and make amends. Because if I don't, what do I do with those memories or those events if I just go and just focus on profit? Making money, going to the mall, all that stuff. I had to honor their, well, I hate to say it, I hate to say sacrifice, but I had to honor their sacrifice. So, work on building community. I was struggling with that because I didn't have the language to describe what I was thinking and feeling. And honestly, I wanted to grab people and I wanted to drag them through the mud. I wanted to drag them through the blood. I wanted to drag you all through the wretch of it all because I wanted you to know what it felt like for that human suffering to take place, because I never want to see it again. I don't want my sons to witness those types of events. I don't want anyone else in here or your family members to be in those types of circumstances because they're awful. I didn't have the language. I was struggling with heavy emotional responses, and I was also dealing with post-traumatic stress disorder, major depressive disorder. I was suicidal. I was cutting myself. I was also a practicing Buddhist. I was going to be a Buddhist monk at one point, and I was a wreck. I was a mess. But I attribute all of that to moral injury. My path is, when I first met Peter there in Edmonds Community College, I was a mess. 1 year removed from military service, and I was hating myself. And my guess is that he could probably tell, as could everyone else. And so anyway, through the course of my life post-war, I came home, I sat with the raw emotions, I experienced the voicelessness of it all, and then I was introduced to eco-therapies. And that changed my life. That's the story of the cedar tree. And that's how I was connected with the Veterans Conservation Corps, through the Washington State Department of Veterans Affairs. Really magnificent program, especially working in volunteerism. Service learning is one of the most important acts we can provide for our country, because we're building each other up and we're restoring. Yes, ma'am.
Yes, I am a mental health counselor, and I just like to share briefly about work injury with one of my clients, Vietnam vet, and he was doing the same job you were doing, but he was in the Army.
That's awesome.
So what happened with him is he loved art, and he studied art, and when he was so in his suffering, he was so angry and so ashamed, and he wanted to express his suffering and make other people see it through his paintings, and they were very graphic and very bloody. So with the work that we did through the years, now he's painting beautiful landscapes. And it was, we didn't understand what was going on, but he was basically more angry. So people can overcome that.
They absolutely can. Yes, thank you so much. That's wonderful. Where was I? Thank you for that.
Community.
Community. Thank you so much. The ecotherapist helped me build community, helped me provide service, and helped me atone, from my point of view, helped me atone for my sins, in a sense. I connected to community in several different realms. Through the ecotherapy work, I was working in communities in South Seattle who are overburdened by industrialization and all these different types of chemical pressures and that sort of thing, where life expectancy is drastically lower than in suburban America, that sort of thing. So I was connecting with communities, I was learning about human beings, and we were building each other up. And that helped me find voice to what I was thinking and feeling. I kind of started to work backwards. I ended up kind of defining my professional identity first, and then I went to school. But through the process of education, it was a liberating act, because I was breaking the shackles of my past, in a sense. I literally felt I was stupid for most of my life. And education helped give me the voice I needed to speak to all that I was sitting with. And I made meaning of my life and in my work towards making change. Moral injury is necessary for the human condition because it's part of the human experience. The important part about this whole conversation, we'll get to it as we talk more about self-care and stuff, and why it's important to recognize these patterns in others, so that we can help them give voice to voicelessness. So they can process the heavy stuff that they're sitting with that aren't symptomatically diagnosed. Right? How many members of this community here in this room today serve others actively? Yeah, and that's why we're here, to build each other up and to make connections so one less person suffers the way others have. What does it mean when human or environmental damage fails to inflict moral injury within the individual and within the community? And this is kind of what I was touching base on earlier when I went off on my whole little prompt about moral injury being necessary, walking past homelessness, and not doing anything about it, because I feel like, because of just the way things are, we're busy, and we become numb to human suffering. And I would just like you to sit with that for a little while, especially in the weeks or months past this conversation. Does it prompt us to make a change? We can't go out and save the world, but one person, one circumstance, right? We can make a difference. Next slide, please. All right, consequences of moral injury. Living with pain, emotional and physical. Especially, I really appreciate that you brought up I think he left, the individual brought up that our nervous system is connected to our emotions, right? And that elicits physical response to what we're feeling. There is an overlap with internal pressures like PTSD and may demonstrate through high risk Go, Jeremy. High risk or risky behaviors such as gambling, dangerous activities, addiction, and others. And it can lead to self-harm behaviors. Next slide, please. How are we doing on time? Hopefully I have to okay, we're doing understanding the self and understanding others. Through self-reflection, we must ask, what are our norms, biases, and activators? Why am I saying that? Norms, biases, activators. What's the point? Yes?
Because they all exist.
They all exist, right? I think, oh yeah, I did add the transference and countertransference in there, because we'll talk about it. I have a habit of jumping ahead of the conversation, so I apologize. What are the norms, biases, activators? Who am I as an emotional being? How do I relate to other emotional beings? And how do I address these parts of myself in personal and professional realms? And the question I have for each of you is, how do we learn from others to support them best? Any thoughts? How do we learn from others to support them best?
Understand them.
Well, we work to understand, right? And we do that how? Listen. Talking, listening, active. We practice our active listening skills and that sort of thing. But we hear, sometimes we even read between the lines of what's being said and what's not being said. And then we challenge them. We challenge ourselves by asking questions and engaging in conversation to get to know them better. Yes?
You want me to wait for the microphone?
Well, we're recording the session, so your voices will be recorded when this happens.
I think it also comes from truly investing in their story, not just asking questions or listening because it's a part of your job or it's what makes you feel good, but truly investing in learning in who they are and what their story is and why they are the way that they are.
I love that you said that. It reminds me of this gentleman. His name is Ignacio Martin Barro. Anyone familiar with that name? He was a Jesuit priest and a psychologist, clinical psychologist in El Salvador during their civil war in the 80s. Anyone remember that time period? It was a brutal campaign. And he worked tirelessly to align with the people that he was working with. He engaged with them. He learned about them. And in his work, he helped give voice to what their experience was, what the impression that they were experiencing. And then he was murdered by the government for speaking out. But we engage with the people that we're working with, and we align with them. We don't have to go on a crusade, but if people can tell, right? If we're connecting to who they are, and if we're working with them, versus if we're just saying we are, kind of like that. Yes, sir. Norm is our patterns of behavior that we normalize. What's our normal routine throughout the day? That sort of thing. And really, why I'm asking these questions is for us to be conscious of where we're at emotionally with our work and the people that we engage with. How many of you have worked with someone that you just absolutely could not, well, you didn't favor them very well. Yeah, there's some hands here, right? And that happened for a reason. Well, maybe you're rude. But if they're rude, people have treated me rudely often. People disrespect me, absolutely yes. And sometimes it hurts and sometimes it doesn't. But when it does hurt, it's hurting because it's activating something from my past. I have to know myself. If I'm going to engage in this work, and if I'm going to work with the community, and if I'm going to work with individuals and help them through the internal and external pressures of their lives, then I have to know myself to such an extent that I'm conscious of my emotional space, so I'm not impacting their emotional space. They've got enough to deal with, not myself. And so that leads me to transference and countertransference. There are some critical minds in here. What is transference? I have a psychologist. He was my psychologist for 10 years, and he's also the chair of my dissertation committee. It was so awesome. He's such a nice guy. But I found him endearing in my work with him because he reminded me of Jeff Goldblum. And I was like, oh man, this is the guy from The Fly. And just that, I was like putting my past onto him, and that helped me make a connection with him and that sort of thing. That's an example of transference. The client putting their stuff onto their therapist, or their social worker, or their case manager. So then what is countertransference? Yeah, it's the flip side, right? So when I brought up, like working with someone that you don't really like that much, and for me, it's because they're bringing up themes from my past. And sometimes I have strong emotional responses with that. I remember this one woman, she was a bit of a narcissist, but her circumstances were intense. And she needed assistance in finding a house, to have stable living and stuff. So, and she's dealing with her symptomatic stuff that we're on diagnosis at the time, but she's also scared out of her mind. And the way she talked to me brought me back to my mom. And I was just like, oh man, I can't work with this person anymore, she's too much. And I was like trying to push away, I was becoming distant, and I stopped connecting, I stopped doing my job, point blank, because I was sitting with too many emotions. Countertransference. Next slide, please.
Question on the transference.
Yes.
So, I got a lot of case managers who are not.
I have case managers that I work with that have not been trained clinically. So the term of transference, countertransference is not in their universe at all. But what I've witnessed with the case managers that they're susceptible to secondary trauma working with the veterans that they're working with, especially a young case manager that doesn't know any better, of the veteran trusting them enough to share a story. And we're going to be respectful, the young case manager is going to be respectful and listen to that. It takes a case manager longer in the tooth to figure out how to build the defenses so they can work in that career field without getting burnt out from hearing those stories. But I guess that transference, that secondary trauma to the untrained, that they just want to be a brother or sister to a fellow service member, right? And there's that compassion fatigue that's attached to that, and that can lead to the burnout, and then all of a sudden they don't want to be in that job anymore. Can you talk a little bit about on that?
Yeah.
And how that compares to the transference?
Thank you very much, and especially if I understood correctly, because you're relating being unprepared for the emotional intensities of the work, which could lead to burnout. In that, did I? Okay. And so effectively, if we're able to, and that's why this conversation of incorporating self-care into the dialogue of understanding moral injury within ourselves and others is so important, because we have to take care of ourselves, and it starts by having a voice. We have to know how to speak to what we're thinking and feeling. That's true for the clinician, that's true for the medical doctor, that's true for the nurse, that's true for the client or patient. It's true for all of us, right? And so if we're able to speak to our needs, we're able to set boundaries, we're able to consult with others, and walk through the challenge, that helps limit the possibilities or probabilities of burnout. Did I answer your question? Thank you. Yes?
I just want to add that really good clinical supervision is a part of that. And it sounds like he's very knowledgeable and he can provide that clinical supervision. Has to be a safe place to say, I don't like that guy. And then have a conversation about why that is and work through those issues. Because if it's not a safe place, I've been doing this 35 years, and I work at the King County Jail, and I had a guy that was just a complete sociopath and personality disorder, and he was assigned to me. And week after week after week, and I went to my supervisor, who was a clinical psychologist, and I said, Ryan, I hate him. And he said, okay, I get that. Can you still do it? I said, yes, I just want you to know that I hate him.
I really appreciate that you brought up, well, one, supervision, having someone to communicate with in a safe space, which helps us normalize what we're thinking and feeling. And that's part of the norms definition. Yes, sir.
How do you get to that point? I'm like a services, and I work with they have to come in, all I want to do is a lot of paperwork and send it on. But they sit there and they start dumping on you. And they keep going and going and going and going. And I don't want to sit there and tell them, get the hell out of here, And I don't have that whatever to answer them intelligently or come up with some wise sayings. stuff like that. But I sit there and listen to them, and it happens again and again and again, you know. How do I keep from going wacko from them?
I appreciate that, yes. And so we will touch base on that, but to kind of, to directly answer that question in a moment, we do it through repetitive conversations. We do it through a practice of unconditional positive regard, which I'll get to in just a moment. We do it with patience and tolerance and creating safe spaces and all of it. And it's the repetitive nature of this, because there is science behind this. It's science. But the reality is, the more conversations we have helps us develop new neural pathways in time. Because our neurons are firing as we have conversations, and they're looking for connections, but they're not connecting deliberately. They're reaching out randomly, and when they do make a connection through this slow process of thinking and feeling and talking, then eventually it creates more and more and more, which helps us diversify our neural networks, that helps us process information in different parts of our brain, and helps us think more rationally when we need it most. What's going on with someone who's living with major depressive disorder or post-traumatic stress disorder? Effectively, their neural networks are being pruned away and intensified in a space where it's raw emotion, fight or flight, right? And so we talk and we talk and we talk, and we give resources and we help them connect in ways that gives them a voice eventually. I hope that answered your question. In the back, yes?
I just want to say that women tend to freeze, so the fight or flight, we also need to add freeze to that.
Oh, yes, fight, flight, or freeze, yes. Yeah, absolutely. How's everyone feeling about transference? It's an unconscious pattern where a client projects emotional realities from past relationships into the helping professional. Next slide, please. And then countertransference is an unconscious pattern where the highlight unconscious pattern where the helping professional places their unresolved histories onto their client. Next slide, please. 15 minutes left? Oh, 3? Okay, I'll make it quick. So taking care of the self and taking care of others. It starts with taking care of ourselves. We have to. We have to take care of ourselves, because if we're not taking care of ourselves, how the heck can we take care of anybody else? Point blank. And that starts with being mindful of who we are. Self-reflection, I swear, self-reflection is really where it's at. If we boil it all down, past the jargon, past the labels or the theories and that sort of thing, if we know who we are, if we're paying attention to ourselves and we understand what activates us, then we're in a more conscious space. Think of it like an animal with their leg in a trap, right? When you reach to help them, what happens? They'll like go back, or they'll try and bite, or like they're reacting. And when we're reacting, we're not productive in our work with others. So we have to be conscious of ourselves in order to move forward. Also, that means being mindful of our needs, being mindful of our boundaries, and respecting our boundaries and the boundaries of others. We have to practice self-care. And approaching your work from a foundation of unconditional positive regard. I wish I had more time. I'm so sorry I dragged on for so long. Which means that we see someone as they are without judgment or condition.
30.
Oh, I am partially deaf in my right ear. I have 30 minutes left. Oh,
Gosh, that went fast.
So we have to practice self-care. It's nice to be able to slow down a little. Approaching our work from a foundation of unconditional positive regard, which means that we see someone as they are without judgment or conditions. When I look at someone, I'm making judgments. I'm assuming all sorts of stuff, like what the heck is that person wearing? Or what's going on? Or that person looks like a big giant D-bag. These things are going on all the time. Is this just me, or is this everyone? Okay. We're normalizing the experience. Being human. That's good. We make judgments all the time. But unconditional positive regard is not the absence of the judgments, but we are assuming the best in the people that we work with. I can look at someone who it has been really just awful to me in my past, and through the practice of unconditional positive regard, I can understand that they're that way for a reason. Y'all hear this sort of like thought experiment of, what is it, nature versus nurture? What is that? Nature versus nurture. What's the whole argument there? Yes?
So I'm going to use a non-emotional example. So nature versus nurture could be, you may have been born with hearing loss, or you may have been raised in a home where they just have the TV really, really loud. And so you develop hearing loss. Everybody grows up in that family with hearing loss. It keeps on happening. Is that nature or nurture? That was nurture. They weren't born that way, but nurture that way.
I love that. Thank you very much. Nature, if I carbon copied a million versions of me, it would be so awesome. And I spread all these Jeremys across the globe in all these different communities and different circumstances. Will we all be the same person? We would share some traits like our wonderful personalities. That would be universal, but we would be completely different people. Like there could be some Jeremys that are working strictly for profit. There could be some Jeremys that really is a hateful person. You know? There could be some Jeremys that's a priest or whatever. And that all depends on two factors, our genes and our environment, right? And so when I look at unconditional positive regard, and I'm working with people who could be categorized as difficult clients. I hate that term because I always see them as difficult therapists. But anyway, someone who's giving me a hard time, I also understand that, damn, this person is institutionalized. This person doesn't know any other language but violence. This person is terrified of being homeless. I mean, is that true? I mean, from your experience, do you feel like that's a true statement? There's something behind because of the culmination of their histories that brings them to the space that they are. And they haven't had the opportunities of education and self-reflection that I've invested years in. They haven't had those resources. So they don't have the language to speak to their needs, and they're raw, emotional, reactive animals in that sense. Unconditional positive regards help me see people for who they are, not as a label, not as a diagnosis, but as a human being who's going through some business. And if I'm really aligned in this work, then I'm gonna take note, and I'm gonna work with them as an equal. Next slide, please. So it starts with did I already?
Yeah.
Oh, I did. Oh, okay. Practice self-care, approaching your work from, oh, there it is. Why did I do that? We have to actively listen. We have to be curious, no judgments, right? So if someone says something that we might take offense to, we don't understand, do we judge them for it and use language that's pointed? Or does that give us an opportunity to say, I'm wondering, what do you mean? It depends, that's true. And so you bring up a wonderful point, because it depends means that sometimes we do have to stand up for ourselves. Sometimes we do have to assert ourselves and that sort of thing. But as a basic practice, actively listen, be curious when necessary, but we do have to have boundaries, right? We have to know what those boundaries are. Meet people where they are and learn from them. Next slide, please. All right, here we are, Oneself self-care. In a previous conversation, it was like at the conference 3 years ago, I asked everyone individually, and do y'all feel comfortable with just giving me one example of your practice of self-care?
Yes.
Is it okay if I start with you? No answer yet. Check. But that's speaking to your needs, self-care.
Meet me where I am.
Here we go.
Take some quiet space for myself.
Quiet space, check.
Take care of myself and my space.
There you go. Take care of yourself and your space, absolutely. Friends, absolutely.
Self-aware of my strengths and weaknesses.
I love it. Yes, sir.
Always being mindful.
Always be mindful. Always be mindful.
Breathing exercises.
Doing what you do on a daily basis.
Thank you.
I walk.
Time in the woods.
Time in the woods. Heck yeah, thank you so much. Sir?
I appreciate sports.
Sports, so playing sports, watching sports, both? All of the above?
I play video games.
I do too. Discharge, to help me decompress.
Lifting weights with my son and hanging out with my daughter.
I love it.
Drink water.
Yes, thank you so much.
Opening my creative side with woodworking.
Ooh, I like that. Nice.
Going to the mountaintop.
Is that a figurative or is that an actual mountaintop? Oh, that's awesome. Nice.
I would say going to live music.
Live music guy. Again, Living Colors in Seattle on September 13th at the Crocodile. If anyone wants to go, please let me know. I'd be happy to go.
You said it, Living Colors.
You're hosting?
Art, drawing, and music.
All right, awesome. Thank you. Hike.
Physical activities.
I'm just gonna go with Netflix and chill.
Deliver practice of leading work.
I crochet.
Crochet, aye.
Reading.
Reading.
After dark sniff walks with the dog.
Exercise.
Gardening.
Gardening.
A regular sleep schedule.
Yes. Regular sleep schedule meaning you're getting 6 to 8 hours of sleep at night. Yeah. Sometimes I go 2 and 3 hours. That's not self-care. That's anyway, yes.
I'd say gardening.
Excellent.
I aggressively protect myself.
Outstanding. Thank you.
Because I don't know if you're asking us for my work or for personal.
Whatever comes to mind.
Having this situation.
Nice. Thank you. Please. Thank you.
Chocolate. Go for drives.
Boundaries.
Boundaries, aye.
Homesteading.
Chickens. Just playing video games with my kids.
Roger that. Thank you so much. Heather, you're not immune to this.
My kids.
Kids, aye.
My dog.
Good sleep hygiene.
Good sleep hygiene. That's come up a few times.
Work is work, home is home.
Excellent.
Spending time with my grandkids.
Choosing to be selfish with my time.
I love that.
Oh. Getting my Montana fixes when I need them.
Oh, nice. Family in Montana or just love the region?
It's where I'm from, it's my home. That's where I cross the street.
Awesome.
Morning coffee.
That.
Exercise and the sleep.
Isolation, especially at a waterfall with my bestie.
Wonderful.
So I struggled with this for a long time because I hear all these advanced, like I'm gonna go, I don't know, on a cruise. Mine was like just getting up and taking a good hot shower, but when you're working with homeless and dealing with those people on a daily, it felt guilty to have a little pleasure. So a house over your head and good food on the table. I really struggled with this for a long time, so yeah.
Revel in my moral injury and use it to energize my work to try to correct what was saving some room for my wife and children in my life.
Thank you. That sounds like post-traumatic growth.
Before a major vacation or occasion, getting a pedicure.
Awesome.
Yeah.
Exercise.
I'm gonna go with music.
Birding.
Gearhead, build and ride anything that with a motor.
Read books that have nothing to do with my work.
Disconnect from social media.
Music and video games.
Yes, thank you. Awesome. And then,
That row. Yes, this row, that's row.
I'm still trying to figure that out.
Roger that, speaking to your needs.
Personal building projects.
Nice.
Taking a nap.
I'd say gardening and also cleaning house.
I like to bake.
Oh, yeah. Thank you so much. So I like to go through and ask examples from everyone. I do see your hand up. Yes. You didn't go.
Someone brought up being selfish with their time, and I tell my veterans all the time, it's okay to be selfish, it's not okay to be malicious.
Yeah. Yes, excellent. Thank you so much. Why, just a side note, selfish with time. Why is that important, especially if we're working in service of others?
You never know when we're gonna die.
What's that?
You never know when we're gonna die.
That's true. I read this research article on, sorry, yes.
Our own cup needs filling too.
Our own cup needs filling too, and that's exactly what I was going to get at. This research article about indigenous healers and kind of this general idea of as they heal other people, what happens to their soul? And it's the belief that they impart part of their soul into other people and then eventually they deplete. So they do have to restore, right? Yes?
So what I tell I tell my healers at the clinics that are non-native and native is that in our belief system that you are a hollow bone and Creator works through you to heal other people. And if you're broken, you're not going to be able to heal anybody else. So you need to take care of yourself, make sure your bone is whole so that you can be of service to others. And so part of it is when we do that energy work, we're getting some of that energy work through ourselves and we're absorbing that. So you got to make sure you're doing it right, and doing it in a good way with good intent. I always tell people, every tribe does ceremony differently, but it's about your intent. What is your intent? And and then you should be good.
Thank you so much. Yes, absolutely. I like asking everybody that question because, well, one, we get a bunch of different examples, right? Heard a few similar examples of self-care, but really self-care is everything that we have an opportunity to do for ourselves. Regular sleep pattern, brushing our teeth, taking a shower, going on vacation, anything, big or small. There's one thing though, I don't think I heard anyone say, maybe they touched on it. How many of us sit with negative self-talk?
Oh yeah.
Oh, okay, so a few of us, right? Okay, so we're sitting with it.
We sit with negative self-talk.
And so part of self-care too is reframing that negative self-talk. Is that being a cheerleader? And this is something we can help the people that we work with also, right? I always use the example of, I used to say I was stupid all the time, and then I stopped saying that, and instead I said, I'm not getting it right now. I'll get it later. I'll figure it out soon. Whatever it is, but that takes away the edge of the words, right? Because calling yourselves a name, it hurts, even if we're used to saying it. Self-care is all sorts of different practices. Next slide, please. Self-care is the active practice of caring for ourselves in all realms of our lives through acts and routines that are big, small, and everything in between. I'm successful, kind of. And I imagine there's probably a lot of kind of successful self-care practitioners in this room because there's elements where we fail, right? We don't take care of ourselves quite right. I am a closet eater. When I'm emotional, when I'm feeling the funk, what do? I like to grab a Snickers bar and I'll go and I'll eat that sucker and enjoy it, and it gives me a little bit of relief, but what does it do to me? So it's self-care in a sense, but if I do it too often, it does expand my waistline, which is something I'm sitting with. So it's about being also conscious of ourselves. Again, coming back to the consciousness. Everything examples includes what everyone just described, and BSDP. I do believe that's a typo. I'm not sure what I'm trying to say there. No, next slide, please. So then we just have to put it to to practice. And I did hope to do audience participation with this. And we can just say just some examples of what steps will you take in practicing self-care in your daily life. You've already mentioned what you already do, but what steps, what can you do new that you haven't done before? Yes, sir.
Well, it doesn't really align with exactly. It doesn't really align exactly with what you're looking for, but has anyone heard of the MBTI, National Veterans Training Institute?
Yep.
All the DevOps, Vet Reps are mandatory for at least a week or two in NBTI. And I was attending, it was about 2011, and I wish I remembered the professor's name, but it went by Dr. Bill, who's a psychologist, and he told us about working with Vietnam vets for 20 years. And so I asked him, like, with vicarious trauma and stuff, how can you do that, you know? And he said, have you ever seen the movie Ghostbusters? And I said, yes, I have. And he says, on my way out the door, I get to my car, and he's like, hold that. And he's like, before I put that key in the door, I'm de-sliming. Because he said, I'm not taking that trauma home to my family, and it just stuck with me ever since then.
I love that. It's like debunking. That's wonderful. Yes. What other examples might there be? What else could you do as a step towards self-care for you that you haven't done before? Yes. Oh, two.
Oh, okay. I think someone actually mentioned that they had self-awareness, and I think a lot of it is taking your own inventory. So taking your own inventory and kind of figuring out the pieces that everyone's, what they're feeling they're missing is different. So I think that it's taking an inventory in a regular time frame, like reevaluating and then kind of moving forward with whatever piece it is. So setting small, manageable goals, you know, as far as like, I want to exercise more, so start out by walking twice a week. Like, it doesn't have to be a big giant step, it just has to be a small step, and I think that helps with the people we serve as well sometimes. Like, I'm not a counselor, so I'm not going to pretend to counsel somebody, but if someone asks me what I do, then I'm like, well, I tried baby steps, like one thing at a time, or let's try it together if that's the situation that you're in, or whatever, helping. So I think just being self-aware and reevaluating.
I love it. Continuously inventorying, continuously checking in is a great practice. Thank you for bringing that up. Yes?
Yeah, I'm kind of hanging on to that because right now I'm trying to drink more water and trying to make it a ritual. So I think it comes down a lot to like making it a ritual, so making it a habit, so you don't have to remind yourself, oh, I want to go for a walk. You just happen to do it because that's what you do. So I try to do that in a lot of things, to practice more rituals that will then help me in my self-care.
Outstanding. Thank you very much. And I think I see, yes, sir.
Coming next to you.
So I talked to this old guy probably about a month or so ago when I was buying a new boat and going out doing a lot of fishing. He's like, look, you basically get 80 summers in a lifetime to do what you want to do. And so like this year is the first year I've taken a vacation in 27 years. So
bravo, Sue.
Time to go free fishing.
Awesome.
I think for me, and it's not necessarily something new, but it's something I need to get better at. And it sounds really cliche, it's something that is talked about a lot, but it's just practicing mindfulness. And specifically in that, my therapist actually just gave me this exercise this week, but she calls it flipping the butt. And so it's when you're talking about something, and we tend to list the positive first and then the negative second, and that leaves our brain with that negative thought. So like for me, specifically coming to this conference was a little bit of a barrier for me because I have not been socially active the last couple of months. And I said, yeah, I'm excited to go to the conference because I'm gonna see a bunch of people I haven't seen for a long time, but I don't know how I'm gonna take it socially. And she said, I want you to flip that butt. So I said, okay, well, I'm nervous about going because I don't know how I'm gonna feel socially, but I'm really excited to see some of the people I haven't seen in a year. And that, it really just changes the way that your mind looks at things. And so like I said, practicing mindfulness is so cliche today. Everybody talks about it. It's a trend, you know, it's on social media, but it really is a powerful and an easy move for us when it's something we intentionally start doing.
And look, you haven't seen me in 3 months. Damn.
Yes, yes,
I think going back to the awareness, but also scheduling it. So I know you talked about that you are wanting to drink more water. There's actually an app that you can download that triggers you to drink more water. So just like having to schedule it.
I have a Duolingo app. I'm learning, my wife is German, I'm trying to learn German. And it reminds me, but it does it with these like angry eyes. So, I'm just today, I'm like, oh, come on, lay off.
I sweat, go take a sweat or smudge myself.
I'm going to take a big step in my health self-care right now. 55% of the people in this room leave our country as giving a short change in help to the people of Ukraine. What are you going to do about it? And that just helped me a lot. Thank you.
Thank you. How's everyone doing with this conversation so far? Because we are nearing the end, and it's going to be, actually, can we go to the next slide, please, I think? So we're at the conclusion. Moral injury is not a diagnosis in a diagnostic and statistical manual sense, but it is a lived reality. It's important for us, if living with moral injury, to find meaningful pathways forward that help us find peace or acceptance. In helping others, there's no judgment and no bias. Wow, I did not proof my presentation. In working with them, learn from the people that we work with and walk with them, and help them make the connections they need to move forward. I really want to stress that, the connections they need to move forward. When I'm working with someone, I will, in my mind, I'm like, you need to let that person go, you need to go do this, you need X, Y, and Z. But that's not for me to tell other people how to live their lives. That's a form of control. So we really have to help them find the language they need to make the connections that are relevant to them. There's no one way to cure mental illness or to work with moral injury or anything else like that. It's individualized. So as you're working with the people that you're working with, please remember that we all need individual pathways forward. We cannot effectively help others until we have worked on our own stuff and to, oh my gosh.
It gets better.
It just means you're human.
This life's exhausting.
I'm just waiting for you.
True point. Somebody's tired.
Okay, yep. Thank you all for your thank you. Thank you for walking me through this. We must employ a practice of self-reflection, unconditional positive regard for others, as we should for ourselves, and we must care for ourselves. We have to be as patient with others as with ourselves as we are with others. We've seen the doctor, we've all seen that metaphor of the doctor who says, you gotta stop smoking, man. This is gonna kill you. And then you leave in the clinic, and then what's that doctor doing? They're out in the smoke deck, just kind of puffing away, going for the guy. And it's like, okay, but again, we have to be able to take care of ourselves. We have to be conscious of who we are. In this work especially, because this is emotional stuff, right? I love the human condition. It's one of the most fantastic experiences, of course, of my life, because I'm human. But it's wonderful, not because it's a perfectly prescribed pathway forward. It's ugly and, hypocritical and messy, and it's just this convolution of just stuff. But that's what makes us uniquely beautiful as people. Regardless of our circumstances and where we come from, that diversity of experience is what makes us who we are. And that's what makes us beautiful individuals. Thank you all so much for your time. Thank you so much for the conversation and for your service to the community. And I'm here to answer any questions, or we have time for questions and stuff? We actually have 3 minutes this time.